think it's a good time to bring in our friend, Dr. Mary Gillis. Hi, Mary. Happy Friday.
Hi, friends.
Hey.
Thanks. Great to be with you guys. Okay, so let's kick it off. According to the CDC, the opioid epidemic continues in the U.S., and it's only getting worse. The center's latest data shows more than 70,000 Americans are dying each year as a result of an overdose, a number that has quadrupled since 1999. In a new study published in the Journal of the American Medical Association, researchers say part of the problem is tapering or slowly reducing the dose when it comes to come off the pain medication. Researchers at UC Davis assessed about 150,000 patients who were prescribed opioids. They followed them for 1 year and 2 months following complete drug elimination. They found a 68% increase in overdose events in those patients who were tapered off the medication and a doubling of mental health crisis among those weaning off compared to those who came off the drug immediately. Senior author Dr. Joshua Fenton said in a statement, "Our study results support the CDC guidelines for clinicians considering opioid dose reduction for patients, but I fear that most tapering patients aren't receiving close follow-up and monitoring to make sure they're coping on lower doses."
Wow.
That's a big deal.
It's a big deal.
Especially when it comes to opioid news or anything like that. I mean, something that our community has been struggling with for quite some time.
Yeah, interesting. I mean, tapering versus immediate sort of cutting it off and closely monitoring too with doctors. Okay, next one, here we go. Believe it or not, flu season is quickly approaching. When the time comes for vaccination, researchers from the University of Miami Miller School of Medicine are encouraging all Americans to get the shot, not only for flu protection, but to protect against severe complications of COVID-19. Researchers assessed about 75,000 patients and divided them into two groups. Those who had COVID and did not get the flu shot were 23% more likely to end up in the ICU because of the coronavirus, 60% more likely to need hospitalization. They were also 58% more likely to suffer a stroke and 40% more likely to suffer from blood clots compared to those who did not get the vaccine. Okay, we'll move on to one more that we have. Okay, what do we got? Guys, I think you'll like this one. Yale University researchers have found that children with autism are more likely to pay attention to puppets than people. Children with autism spectrum disorder, or ASD, and those without were shown a video featuring a puppet named Violet. Scientists observed both groups and found the attention span and engagement with the puppet was nearly identical in terms of attention and engagement between the two groups. The benefits were similar between mild and severe cases of ASD. The findings, they say, quote, lend scholarly weight and suggest puppets could be a powerful tool to help children with ASD improve engagement, which is very exciting. Study authors worked in collaboration with 1984 Yale alum and daughter of the late puppeteer Jim Henson.
Really? Huh.
Those are Look at Your Health headlines.
That's like all of our childhoods right there.
Yeah.
Isn't it?
No wonder why that was much more fun.
I'm not shocked because, you know, kids pay attention to cartoons more than us adults.
That's
anyway.
true.
I found that out.
Especially since Chief Meteorologist Ashley Brown has been singing all of the cartoons for like the last couple of days.
You know, my daughter likes Coco Melon. Shape, shape, shape,
Shout out to JJ.
shape.
Shout out to JJ and them.
Yeah, I know, right, Cody? I'm all about Coco Melon these days.